elaborate on the different mental health issues that you've come across, different age groups and gender?
So in my clinical practice, I largely work with the adults. So I have my colleague who works on the child and adolescent. So I won't refer that age group here. I think during the pandemic, largely initially first year, what at least in my clinical experience, I saw is a surge of people from two age groups. One age group was young adults, or what we call as just who are doing graduations or postgraduates, and then the second age group was the old people, and largely because all the restrictions when they went through, I think that restrictions have affected them, as well as the pandemic has stopped their day-to-day activities for these young adults as well as for the old age people. Issues what we saw increasing in that first year of pandemic was largely of anxiety and depression, followed by and so those are the main issues. In the old people, sleep related issues was also at the forefront, and plus even if you don't classify a few issues like depression and anxiety, in the young adults there were a lot of behavioral issues like anger related or related to their behavior, or interpersonal issues, fighting with there are a lot of conflicts at the home or among the family members. So there is a lot of, definitely there is a I will say in my personal experience 20 to 25% increase in the distress levels among these populations. Just the last point is, so in the second year of pandemic, like in 2021 specifically, then what we also have seen is an increase in the surge of adult population. When I say adult, as in the remaining adult, the young adult and the old people, so working population. And largely this was due to the employment issues, unemployment, financial related issues, as well as the conflicts at home, family, and so on. So again, starting from distress, sleep related issues, and then the depression and anxiety. So those were, I will say, just to cover all the age groups as well as the issues what I have seen in my personal experience.
Right now, we are facing mental health catastrophe. Okay, and this crisis is having its effect long term as well as short term. The groups like kids who are minors, they are having their own issues. The scar of the pandemic is going to be there for a very long time, and it's quite evident. From the restricted growth to habit formation malfunction to continuous exposure to the gadgets. There were many kids who were not exposed to the gadget at all, and now they are overexposed and too much information. Socialization got damaged equally. Then adults are, of course, they are having overthinking, anxiety, depression, mood disorders, a lot of hypochondria, that is health anxiety, relationship problems. All these areas have been there. And coming down to the genders, earlier we had typical binary gender were coming across. Recently, in last few years, thankfully, a lot of non-binary people have come across and they have reached out to me, which I feel really good that, the counseling is reaching out and people are thinking about getting counseling. That's really great.
Overall, the experience as well as the data is there are not much of a differences between the incidence of depression or anxiety among women or men. So the causes are different. So, but the expression of that cause or a stress into depression and anxiety is, I think, similar across the gender or even in non-binary, as you said. Though what we have seen is definitely, as I said here already, the increase in the incidence of depression and anxiety. As I told you, the reasons for unemployment, financial issues, or employment-related issues are still more common in men. While in women, I think what we have seen, and here I will bring my experience from a community mental health which I work with, is the increase in the domestic violence. So increase in overall gender-based violence, domestic violence has been an issue because again, during this pandemic, the restrictions, people living at home, everyone living together has increased a lot of spousal conflicts, domestic violence overall.
Everybody is. I mean, we all were craving human interaction, no matter who, what age. The kids were not going out; they were having their own issues. The adults were not going out. Even the senior citizens, the geriatric patients, even they were having their own concerns. So everybody is getting affected in some way or the other, including all the socioeconomic classes as well.
In children, especially during the pandemic, what mental health issues came up? Since you said that you also deal with children from 15 years, right? So, if in your personal experience, any of your clients, what is some of the mental health issues that they experience?
I have the majority of them are from 15 years of age, but I get as small as like 6 years of age as well. And most of them have some of the common issues like adjustment. They are missing human interactions. I mean, recently when the pandemic was, that lockdown was left up and everybody was, trying to socialize. A couple of the parents came and said, my kids are saying weird stuff in front of everyone else. I don't know how to deal with that, because kids lost that social skills, what to say among the people, what is acceptable, what is not. All those things are social skills, socialization, which was really hampered very badly for 2 years. So these are one of the other reasons. One of the other areas was like too much information, the gadgets, the Google. Kids are studying, they are studying online, and they know everything now. I mean, even if the game are about 18 and above, the kids from class third onwards, they know about it and they are playing it, which is not good. So, same common problems, but at different intensity.
So, sir, in your professional experience, has trauma and death triggered any pre-existing and underlying mental health issues, especially during the pandemic?
I will try to say two points here. That one point, as you asked, is definitely people who had mental health issues or who have mental health issues, whether it's largely the severe mental health issues, which are long standing and which are going on for years. Definitely for them, first year of pandemic as well as the second year have been a difficult period to go on. The first important point was basically initially in the first year, the accessibility of medications became the problem because there was restrictions on travel, restrictions on going across the districts. So for them, visiting the mental health professionals, getting access to medications became an issue. And as we have progressed into the second year of pandemic, the issue has been obviously for people who have severe mental health issues or conditions, is that their movability or going out has been stopped. So many people typically who have a very severe mental health condition who goes to let's say some daycares or goes to some NGOs for for their small employments. Now, for them, those employments and those daycares and those residential homes have been completely closed. And for them, then it became a very difficult to cope up with this situation. So that's one part of, I think, the one part of the answer for as you asked. I think the second part, what has happened. Second part, what has happened is. Overall trauma and death, as you asked, so that's a specific issue what definitely has happened during this pandemic, that the death particularly during the second wave in April, March and April 2021, as we saw increased in the death number of deaths, people who had a COVID, and that has definitely triggered a lot of trauma, a lot of grief in people, as maybe in media also it was talked about what we called as a collective grief, because so many people had gone during that period. Almost each of us in our family, extended family or friends, there were one or two deaths, as generally has been spoken about. So and at least in clinical practice, I know there are two families which I have seen during this period. I still remember. In those two families, there were almost 8 deaths, 7 to 8 deaths in a period of 3 months. And that's definitely been a lot of traumatizing, devastating. It basically destabilizes your life and it does impact you in a different manner.
And during this pandemic, a lot of below poverty line people came across, for counseling. They had no money, but they wanted to get counseled. Why? Because of trauma, that I have lost my job once. What if I lose it again? That kind of stuff. And we should definitely consider one thing, that this grief, this loss, this trauma is also has also increased the likelihood of self-sabotaging behavior among the people who can't handle it. From addiction to self-harming behaviors, everything.
What were some of the strategies and techniques that you provided with your clients to deal with the pandemic?
I am answering it on the basis of overall experience with every one of them. Well, one of the thing was like everybody was struggling with sedentary lifestyle. I asked them, the first thing was, please take care of your body. Please notice what is your body asking for. And then another thing that I asked from the starting itself was, ration the information overload. You're reading a lot of newspapers, you're reading a lot of news, and everybody there was like, oh my God, there is no oxygen. Even if nobody's infected in the house, and everybody's worrying about oxygen and getting into panic. And that was something that was asking them to get in, like, I want a counseling because I'm really worried about oxygen. I said, but oxygen is everywhere. You're not going out, you're safe. Don't panic, take care of your body. Make time to unwind yourself. Do some mindfulness activities. That is very important. Refocus on your mind over the aspects that are in your control. You can't control the pandemic like that. You can do your bit, do that. And definitely actively deal with your emotions, practically. That were a few of the common strategies.